How is echolalia diagnosed in Parkinson's? Echolalia is the involuntary repetition of another person's spoken words, and it can be a notable symptom in Parkinson's disease. Understanding how echolalia is diagnosed in this context involves looking at both motor and non-motor symptoms associated with the disease. The diagnostic process is thorough and multifaceted, ensuring that healthcare professionals can accurately identify this symptom. First, a detailed clinical history is essential. The healthcare provider will gather information about the patient's experiences with Parkinsonian motor symptoms, such as slowness of movement, rigidity, tremor, and balance issues. Non-motor symptoms, including changes in speech like slow speech or stuttering, are also documented. It is important to explore when echolalia occurs, how it has progressed, and the context in which it appears. This helps differentiate echolalia from other speech disorders or cognitive issues. Next, a neurological examination is conducted. This assessment focuses on motor function and any related speech-language disturbances. During this examination, the healthcare provider will evaluate the patient's speech, looking for signs of apraxia of phonation, which is the difficulty in coordinating the muscles used for speech, and dysarthria, a motor speech disorder. Observing the patient's spontaneous speech during conversation is crucial for detecting involuntary repetition of words or phrases. Established diagnostic criteria for Parkinson's disease, set by authoritative organizations, guide the diagnosis. While echolalia is not a primary diagnostic criterion, its presence can support the identification of speech-language disturbances linked to Parkinson's or atypical Parkinsonian syndromes. If echolalia is prominent, healthcare providers may consider related disorders, such as progressive supranuclear palsy, which also features echolalia and specific speech-language profiles. Referral to a speech-language pathologist is often part of the diagnostic process. The speech-language pathologist will conduct a detailed assessment of the patient's language function. This includes evaluating verbal memory and echo awareness, which is the patient's recognition of their echolalia. This assessment helps distinguish echolalia from other language impairments, such as dynamic aphasia or non-fluent aphasia. Lastly, while there is no specific test that confirms echolalia, neuroimaging techniques like magnetic resonance imaging or positron emission tomography scans may be used. These imaging methods can help rule out other neurological conditions and support the diagnosis of Parkinson's or atypical Parkinsonism. For example, findings such as midbrain atrophy can increase diagnostic confidence in related disorders that present with echolalia. In summary, diagnosing echolalia in Parkinson's disease involves a comprehensive approach that includes clinical history, neurological and speech assessments, and the application of established diagnostic criteria. Speech-language evaluations are critical in identifying echolalia as part of the broader spectrum of speech disturbances associated with Parkinson's and related disorders. This thorough process ensures accurate diagnosis and guides tailored management for the patient's unique needs. Always consult with healthcare professionals for personalized medical advice.